Your heart beats 100,000 times a day. But what if it's secretly struggling? Today, I'm revealing 5 warning signs that your heart might be failing. Signs that even doctors sometimes miss. And here's the shocking part. Fixing them could literally add years to your life. Before we dive in, if you're experiencing chest pain or severe shortness of breath right now, stop this video and call emergency services. But if you're here to learn how to protect your heart before it's too late, you're in the right place. Let's start with a sign that 92% of people ignore. Sign number 1, the invisible weight gain. Picture this. You step on the scale Monday morning, normal weight. By Friday, you've gained 3 pounds. You haven't changed your diet. You haven't stopped exercising. So what's happening? This mysterious weight gain could be your heart waving a red flag. When your heart weakens, it can't pump blood efficiently. Blood backs up in your veins and fluid leaks into your tissues. This is called edema, and it's one of the earliest signs of heart failure that people miss. Here's what makes it dangerous. This isn't fat gain, it's fluid retention. A 2023 study in the Journal of Cardiac Failure found that patients who gained more than 2 pounds in 48 hours had a 47% higher risk of hospitalization within the next month. So how do you catch this early? Start weighing yourself every morning right after you wake up. If you see a sudden jump of 2 to 3 pounds overnight or 5 pounds in a week, that's not normal fluctuation. That's fluid building up where it shouldn't be. Here's a simple test you can do right now. Take off your socks and look at your ankles. See those indentations where the elastic was? Now press your finger into your shin for 5 seconds. Let go. If that dent stays there, like you've pressed into Play-Doh, that's called pitting edema. Your tissues are holding water like a sponge. The good news? You can fight back. Cutting your sodium to less than 2,300 milligrams a day can reduce fluid retention by up to 40%. That's less than 1 teaspoon of salt. And trust me, it's hiding everywhere. That healthy soup you had for lunch could have half your daily sodium. Those whole grain crackers? Salt bombs in disguise. Sign number 2, the nighttime breathing trap. Let me ask you something that might sound strange. How many pillows do you sleep with? And I'm not talking about comfort here. I'm talking about necessity. Because if you can't breathe lying flat, if you feel like you're drowning unless you're propped up, your heart is sending you an urgent message. This is called orthopnea. And here's why it happens. When you lie down, gravity stops helping your blood flow. Suddenly, all that blood from your legs rushes back to your heart. A healthy heart handles this, no problem. But a struggling heart? It's like trying to drink from a fire hose. The blood backs up into your lungs, and breathing becomes a battle. The European Heart Journal published something that should terrify anyone who sleeps propped up. People who need 2 or more pillows just to breathe comfortably have 3.5 times the risk of their heart failure getting worse. 3.5 times. But it gets scarier. Some people experience something called paroxysmal nocturnal dyspnea. Fancy words for a terrifying experience. You fall asleep fine, then 1 or 2 hours later, you wake up gasping, panicking, feeling like someone's holding a pillow over your face. You rush to the window for air. Your body is literally drowning in its own fluids while you sleep. Now, if you're thinking, well, I'll just sleep in my recliner, you're onto something. Many heart patients discover this by accident. They fall asleep watching TV in their recliner and realize they breathe better there than in bed. That's not a coincidence. That angle is keeping fluid out of your lungs. But here's what most people don't realize. This breathing problem creates a vicious cycle. Poor sleep stresses your heart more. Stressed heart pumps worse. Worse pumping means more fluid. More fluid means worse sleep. Round and round it goes. The solution isn't just about pillows, Every 10 pounds of extra weight you carry makes your heart work 20% harder. Imagine carrying 2 gallons of water upstairs all day. That's what extra weight does to your heart. And if you have sleep apnea on top of heart issues, you're fighting a war on two fronts. Getting a CPAP machine can improve your heart function by 35% in just 3 months. That's not a small improvement. That's transformation. Sign number 3. The fatigue that sleep can't fix. You know that bone-deep exhaustion that sleep doesn't touch? Where you wake up after 8 hours feeling like you haven't slept at all. Where climbing one flight of stairs leaves you bent over, catching your breath like you've just finished a marathon? This isn't being tired. This is cardiac fatigue. And it's fundamentally different from anything else you've experienced. Here's what's happening inside your body. Your heart is like a delivery service for oxygen. When it weakens, it starts rationing deliveries. Your brain gets priority. Your vital organs come next. Your muscles? They're last on the list. They're running on fumes, trying to function with half the oxygen they need. The American College of Cardiology dropped a bombshell in 2024. They found that unexplained fatigue was the very first symptom in 69% of women with heart failure, nearly 7 out of 10. For men, it was 54%. Yet it's the symptom we dismiss most often. I'm just getting older, we say. I need to get in shape. Meanwhile, our heart is screaming for help. At the cellular level, it's even more dramatic. Heart failure reduces your mitochondrial function by up to 40%. These are your cellular power plants, the things that turn oxygen and nutrients into energy. When they fail, it's like trying to power a city with half the power plants shut down. No amount of coffee can fix a power shortage. I want you to try something called the 6-minute walk test. It's simple but revealing. Find a hallway or path where you can walk uninterrupted. Set a timer for 6 minutes and walk at your normal pace. How far did you go? If it's less than 300 meters, about 3 football fields, your heart might be struggling more than you think. Here's something fascinating about cardiac fatigue. Your body develops what I call couch gravity. You sit down for a minute and suddenly getting up feels impossible. Not because you're lazy, but because your muscles literally don't have the energy reserves to propel you upward. Your body is conserving every bit of energy for survival. The fix isn't about pushing through. That's actually dangerous. It's about understanding that this fatigue is a check engine light for your heart. Coenzyme Q10 at 200 milligrams daily has been shown to improve symptoms in 73% of heart failure patients. It's like adding premium fuel to a struggling engine. And if your iron levels are low, your fatigue multiplies exponentially. Getting your ferritin checked could reveal a fixable piece of the puzzle. Sign number 4. The cough that won't quit. There's a cough that doesn't come from your lungs. It comes from your heart. And it's one of the most missed diagnoses in cardiology. You've had it for weeks, maybe months. A dry, hacking cough that gets worse when you lie down. No fever, no congestion. Your doctor checks for allergies, acid reflux, maybe gives you an inhaler. Nothing helps, because they're treating the wrong organ. This is cardiac cough, and here's the sinister way it develops. Blood backs up in your pulmonary veins. Like a dam overflowing, fluid seeps into your lung tissue. Your body's response? Cough it out. Except you can't cough out fluid that's coming from your blood vessels, not your airways. The BREATHE study revealed something shocking. 37% of heart failure patients had this chronic cough for over 8 weeks before anyone figured out it was their heart. 8 weeks of wrong treatments, wasted time, while their heart grew weaker. What makes this cough unique is what comes up, if anything. At first, it's just dry and annoying. Then some people notice white, frothy sputum, like sea foam. That's fluid from your lungs. But when that foam turns pink, when there's a tinge of blood mixed in, that's pulmonary edema knocking at your door. That's a 911 call, not a wait and see. The timing tells the story. Respiratory coughs don't care if you're standing or lying down. But cardiac cough, lie flat, and it's like someone turned on a switch. Sit up, it eases. That's because gravity is pulling fluid away from your lungs when you're upright. Here's a simple thing that helps more than you'd think. Elevate the head of your bed 6 to 8 inches. Not with pillows, but by putting blocks under the bed frame. This slight angle can keep fluid from pooling in your lungs while you sleep. It's not a cure, but it can buy you comfortable nights while you address the real problem. And if you're on ACE inhibitors for blood pressure, they can cause a cough too. But here's the catch. They're often prescribed specifically because you have heart issues. Never stop them without talking to your doctor. That cough might be annoying, but it's keeping you alive. Sign number 5, the racing heart paradox. You're watching TV, completely relaxed, when suddenly your heart takes off like a racehorse. No warning, no trigger, just 0 to 100 in seconds. Or maybe it's the opposite. A stumbling, irregular rhythm that feels like your heart is tripping over its own feet. This is your heart's desperate attempt to compensate for weakness, and it's like watching a car engine redline itself, trying to climb a hill in the wrong gear. When your heart can't pump enough blood with each beat, it tries to make up for it with speed. More beats per minute equals more blood moved, right? Wrong. It's like trying to bail out a sinking boat with a teaspoon. Frantic activity, minimal results. The Framingham Heart Study, following thousands of people for decades, discovered that a resting heart rate over 75 beats per minute increases your heart failure risk by 40%. Let that sink in. Just sitting there, if your heart is racing, your risk is climbing. But irregular rhythms are even more dangerous. Atrial fibrillation, where your heart's upper chambers quiver instead of pumping, increases heart failure risk by 500%. 500%. It's like your heart's electrical system is shorting out, sending chaotic signals instead of coordinated beats. What's terrifying is how subtle it starts. Maybe you feel a flutter in your chest, like a butterfly trapped behind your ribs, or a skipped beat that makes you catch your breath. You blame stress, caffeine, that deadline at work. Meanwhile, your heart is literally remodeling itself, changing shape and size to compensate for its weakness. Here's something that might save your life. Get a heart rhythm app on your phone. Many can detect irregularities just by having you place your finger on the camera. It's not perfect, but it's like having a cardiac technician in your pocket. Document what you feel and when. Patterns matter more than isolated incidents. Magnesium deficiency triggers irregular rhythms, and most of us don't get enough. 400 milligrams daily can stabilize your heart's electrical system. Omega-3 fatty acids, the kind in fish oil, reduce arrhythmia risk by 30%. That's huge for something you can buy at any pharmacy. But here's the real kicker about alcohol. That glass of wine you think is good for your heart? Even moderate drinking increases atrial fibrillation risk by 15%. Your heart is already struggling. Don't make it work harder by adding a toxin to the mix. The science of reversal. Now I'm going to tell you something that might contradict everything you've heard about heart disease. Early heart failure isn't a life sentence. It's reversible. Not manageable, not treatable, reversible. The REVERSE trial turned cardiology on its head. They took people with heart failure and put them through aggressive lifestyle changes. No fancy procedures, no experimental drugs. Just diet, exercise, and targeted supplements. The results? Heart function improved by 40% in 6 months. These patients literally grew new blood vessels like their hearts were regenerating. Think about that. Your heart, this muscle that never stops working from before you're born until the day you die, can actually heal itself if you give it the right conditions. It's like discovering your car can repair its own engine if you just use the right fuel and oil. The DASH diet alone reduces heart failure risk by 45%. We're not talking about some exotic meal plan here. More fruits, vegetables, whole grains, less salt, and processed food. Simple changes, profound results. Add olive oil like they do in the Mediterranean diet, and you slash cardiac events by another 30%. Exercise works like medicine, but better. 150 minutes of moderate exercise weekly improves something called ejection fraction by 5 to 10%. That's how much blood your heart pumps with each beat. Interval training, where you alternate between hard and easy efforts, works 3 times better than steady walking. Your heart gets stronger by being challenged, not coddled. But here's what excited researchers most: supplements that actually work. Coenzyme Q10 at 300 milligrams daily. L-carnitine at 2 grams helps your cells burn fat for energy. D-ribose, 5 grams 3 times daily, directly feeds your cellular power plants. Hawthorn extract, used for centuries, actually strengthens heart muscle contractions. This isn't alternative medicine. This is biochemistry. Your heart cells are starving for specific nutrients, and when you provide them, magic happens. Or what looks like magic, but is really just your body doing what it's designed to do: heal. The critical window. Here's the truth no one wants to talk about. From your first symptom to irreversible damage, you have a window, usually 6 to 12 months. That's it. Use them or lose them. I see the same tragedy play out over and over. Someone notices they're getting winded easier. Their ankles swell a bit. They need an extra pillow. But they're busy. They have responsibilities. They'll deal with it later. Your heart is remarkably forgiving, but it's not infinitely patient. Every day you wait, scar tissue forms. Heart muscle cells die and are replaced with stiff, useless fiber. That window of opportunity gets smaller and smaller until it slams shut. Your action plan. Tomorrow morning, I want you to do 5 things. First, step on that scale and write down the number. Not in your phone, where you'll forget it, but on paper, where you'll see it. Second, count how many pillows you need to sleep comfortably. Be honest. Third, rate your energy on a scale of 1 to 10. How do you really feel? Fourth, check your pulse for a full minute. Is it steady? Fast? Irregular? Fifth, pay attention to any cough you've been ignoring. If you have 2 or more of these signs, you need to see your doctor within 2 weeks. Not 2 months, 2 weeks. And when you go, don't let them dismiss you. Ask for a BNP or NT pro-BNP blood test. These detect heart strain before it shows up on other tests. Request an echocardiogram. This shows your actual heart function, not just electrical activity. And please, don't accept "you're just getting older" as a diagnosis. Aging doesn't cause heart failure. Heart disease does. And heart disease is treatable if you catch it early enough. Your heart has been there for every moment of your life. Every first kiss, every celebration, every quiet morning. It's never asked for a day off, never complained, never stopped showing up for you. Maybe it's time you showed up for it. These 5 signs aren't just warnings, they're opportunities. Chances to intervene before a whisper becomes a scream. To add not just years to your life, but quality to those years. Share this video with someone you love, because the best time to save a heart is before it fails. And the second best time? Right now. Your heart is talking to you. The question is, are you listening? Stay healthy, stay aware, and I'll see you in the next video where we explore the supplements that can strengthen your heart at any age. Until then, take care of that incredible muscle that's keeping you alive right now. Remember, Your heart whispers before it screams. Don't wait for the scream.